Surgery can be a nerve-wracking experience. When avoidable injury results from these procedures, you have the right to claim for the compensation and justice you deserve. What is a surgical complication? All surgeries carry risk, but when a patient suffers an injury because care fell below a reasonable standard, this is considered a surgical complication. Whether this is poor surgical technique or a brief lapse in concentration, a surgeon's actions or inactions can have devastating consequences. What are some notable types of surgical errors? Surgical errors can occur during any procedure. These can include damaging a nerve or cutting a blood vessel, mistaking landmarks and structures, failing to monitor heart rate and breathing, using too little or too much anesthetic, giving the wrong type of blood during a transfusion, allowing a patient to develop deep vein thrombosis, leaving instruments or objects inside the body, poor consenting, negligent post-surgery monitoring. When is medical negligence to blame for surgical complications? Negligent surgery is when a surgeon makes an error that no reasonable surgeon in the same position would have made. Several factors may influence whether a mistake made during surgery is considered reasonable, such as whether actions must be performed blind or the number of previous surgeries a patient has had. How can compensation help after a surgical error? The purpose of compensation is to compensate someone for their injury and to return them as close as possible to the position they were in before their injuries. The range of outcomes from a surgical complication is vast. Therefore, compensation can cover a wide range of costs, including home and vehicle adaptations, future surgeries, ongoing therapies, mobility equipment, long-term care requirements, loss of income. At Gadsby Wicks, our priority is to ensure our clients receive the financial security they need. How do I make a surgical complication claim? When you contact our team, you will be assigned a specialist medical negligence solicitor to guide your claim from start to finish. We will examine all available evidence to determine if you received substandard care, including independent medical opinion, medical records, personal statements, witness statements, complaint correspondence. Our thorough investigations establish if you suffered negligent care that directly led to your injury and quantify the amount of compensation you deserve.